Hello and welcome. Many long held myths and misconceptions about osteoarthritis destroy hope and can make those who are affected feel powerless. Knowing the truth behind osteoarthritis can empower you to take control of your joint health. This video addresses these myths head on, providing clear, factual explanations about what osteoarthritis is and what it isn't. Osteoarthritis is by far the most common form of arthritis, impacting about 595 million people worldwide, or about 7.5% of the world's population. And it's on the rise. The incidence has more than doubled since 1990. These are some startling numbers. But what this means is that many people like you are facing similar challenges with their joint health. Certain risk factors can contribute to the development of osteoarthritis. So, what is a risk factor exactly? A risk factor is if one of these factors here is true for someone, then they have a greater chance of developing osteoarthritis. There are many and include what you see listed here as well as others. It's important to understand the true nature of osteoarthritis as a way to empower those living with it. By understanding the true causes of osteoarthritis and its progression, we can shift our focus towards better management. Let's start by looking at some osteoarthritis truths. Truth: a cellular process fueled by inflammation and other factors is the primary cause of osteoarthritis development and progression. The updated working theory for the development and progression of osteoarthritis is this. Trigger events like injuries, excessive joint stress, or joint malalignment initiates localized inflammation. Elevated systemic inflammation can make these events more likely to be triggering events. In response, the affected joint attempts to fight back with inflammation, but this can cause changes in how cartilage cells behave. Various lifestyle and environmental factors can also change how cells in cartilage behave. Cartilage cells, which normally maintain cartilage health by breaking down old cartilage components and replacing with new fresh cartilage components, begin to change and they break down more than they build. They can return to normal, but repeated triggers and systemic inflammation can just overcome their attempt to return to their normal maintenance behavior. This is a key factor in the progression of osteoarthritis. Understanding this can really help one begin to understand how the environment within our body can impact our joint health. Truth: inflammation is the main contributor to pain in osteoarthritis. Inflammatory chemicals contribute to the sensation of pain in osteoarthritis. These chemicals can irritate and inflame tissues surrounding the joint, triggering pain signals. Pain in osteoarthritis is not caused by cartilage loss, but by other factors influenced by the presence of inflammatory substances. It's possible to experience pain in osteoarthritis even with minimal cartilage loss, or have significant cartilage loss and no pain. But what's important to know is that pain cannot come directly from cartilage. Cartilage has no nerve endings or no nerve cells, so it cannot send pain signals to the brain. Truth: X-ray findings do not predict symptom severity or how much pain you will have. It has been shown time and time again that X-ray findings of osteoarthritis do not align with symptom severity. Some people with minimal joint damage on X-rays may experience significant pain, while others with advanced joint degeneration on X-ray can have pretty mild symptoms. Just because advanced disease is seen on imaging does not mean that one will have severe or even moderate pain. Even an X-ray that gives the impression of bone on bone does not guarantee that someone will have pain. Truth: not everyone with osteoarthritis will experience progression. Osteoarthritis has a wide range of progression patterns. The impact on joint health and function can vary greatly from person to person. Many people with osteoarthritis will not experience disease progression. Some individuals may have stable symptoms or even see improvement over time. Each person's experience with osteoarthritis is unique, and many controllable factors can influence this. Now, on to the myths. I spend time on these because many osteoarthritis myths are hope destroying monsters that can contribute to choices that make osteoarthritis worse, like limiting activities, other protective actions, rumination, and catastrophizing. Myth: osteoarthritis is due to mechanical wear and tear. Contrary to popular belief, osteoarthritis is not simply a result of joints wearing down over time. The wear and tear myth implies that joints naturally deteriorate over time and ignores the real factors involved in the development and progression of osteoarthritis. The belief in the wear and tear concept can have detrimental effects on those living with osteoarthritis. It often leads to feelings of hopelessness and despair, as they believe their condition is an inevitable decline with no hope for improvement. This is not true. Myth: osteoarthritis is a normal part of growing older. If this was true, everyone of a certain age would be diagnosed with osteoarthritis. Yet, that is not the case. Only 1 in 4 Americans will be diagnosed with osteoarthritis. Most older adults do experience some age related joint changes. Everyone experiences some joint narrowing as we grow older. This is why people get shorter as they grow older. But these changes are not osteoarthritis and they do not cause pain. Myth: osteoarthritis will inevitably only get worse. Many people believe that once you have osteoarthritis, it's a rapid one way street to more pain and less mobility. But as we have already discussed, this is far from being a universal truth. Myth: surgery is the only solution. While surgery might be beneficial in some situations, it is not the only way to treat osteoarthritis. And it is often done unnecessarily, too soon, without discussing other treatment options, and can sometimes lead to even worse outcomes. Myth: bone on bone means that bones are grinding together. This is my favorite, the old bone on bone myth. If there are any words that have the power to make pain worse, these are them. This term misleads people to visualize bones grinding directly against each other as if they were stacked on each other with nothing else supporting them. This is anatomically impossible. If our bones were truly resting directly on one another, the immense force delivered with each step that we take would cause the bones to shatter or suffer at least significant damage with each step. In reality, our bodies are designed so that bones within joints are suspended, separated, and supported by muscles. The stronger the muscles, the better the support. There is currently no cure for osteoarthritis, and medical interventions like medications, injections, and other novel treatments have limitations in modifying the disease. While medications and treatments can help manage symptoms and provide some temporary relief, they do not currently alter the course of osteoarthritis or halt its progression. But lifestyle changes can. Lifestyle changes and self care strategies play a significant role in improving symptoms, slowing down disease progression, and enhancing overall wellness. By adopting inflammation preventing and inflammation fighting habits, those with osteoarthritis can actively participate in their own management and strive for a better quality of life, despite there not being a cure. Thank you for watching. I look forward to seeing the improvements that you make by adopting the lifestyle strategies outlined in this course.